Each year, on March 8th, the world marks International Women's Day to renew a collective commitment to achieving gender equality. This year, we are enjoined to invest in women to accelerate progress. I am very pleased to support this message today, as improving the health of all women is one of my top priorities. Investing in the health and well-being of women and girls first requires adequate investment in health overall. On this count, our region is lagging. Countries in our region allocate only about 2.9% of GDP against 4% globally. This means that out-of-pocket expenditure as a share of current health spending is unacceptably high. When families have to pay out of pocket, they will often delay or forego much needed care. How does this impact women? As we know, much of the burden of caring for the sick or older family members falls on women and girls. Women and girls already perform most of the unpaid work in households, spending 2 to 5 times more each day doing such work when compared to men. This highly unequal situation holds women back from truly fully participating in economic and political life. We know we need to accelerate progress towards gender equality and health for all. We've made some gains, but inequalities persist. For example, we've made gains in 3 distinct areas: the proportion of women receiving antenatal care from skilled providers, those satisfied with modern methods of family planning, and those receiving skilled attendants for their deliveries. But these gains are not being equally distributed. Inequities in these gains exist based on women's location, education levels, and household incomes. Another area where improvement is needed that currently policies do not fully recognize a woman's autonomy in sexual and reproductive health decisions. Gender inequalities also affect some risk factors of non-communicable diseases. In our region, women have a higher prevalence of being overweight and obese than men. Often, this is because of less physical activity. This is likely because of gender differences that impact mobility, access to recreation facilities, and perceptions of safety related to crime and traffic. Women in our region also face barriers to access to services, such as lack of a female health provider. They also face constraints of a lack of access to household resources and transport. Long distances to health facilities and weak decision-making powers affect as well. Violence against women and girls remains unacceptably pervasive. This is nothing less than a violation of the human rights and a priority public health issue. In our region, more than 1 in 3 women will experience intimate partner violence in their lifetime. We need to increase investment to effectively prevent and respond to this violence, and to capacitate the health sector to play its role. Evidence-informed, gender-responsive health policies and programs can help reduce these gender gaps in health. Most countries in the region have adopted such national plans. However, their capacity to implement them needs strengthening. I am pleased to let you know that we are currently designing one of my priority programs specifically focusing on women and children. Focusing on women's health has multi-generational impacts on public health, on early childhood development, and even on societal and economic development. This is something the SDG framework also recognizes. The health outcomes of the next generation are impacted even before they are born, and so we must pay a particular focus to the health of pregnant women. Better informed mothers lead to lifelong benefits for subsequent generations. They provide better nutrition for children, encourage active lifestyles, instill cleanliness and hygiene, and other healthy habits. Their knowledge, understanding, and practices regarding their own health are taught to not only their own families, but their broader communities as well. When we improve a woman's knowledge of health, she will teach other women around her. On International Women's Day, I proudly reiterate my commitment to support all countries in the region to increase investment in women's health and well-being, and to accelerate progress towards gender equality. Thank you.